incidence of cerebrovascular accident and its factors among hypertensive patients in a community hospital setting in Thailand, a retrospective cohort study from 2011 to 2022, from Mr. Varathpavee Bhuriveth.
Hello again. Good morning, Mr. Speaker, distinguished guests, ladies and gentlemen. My name is Varathpavee Bhuriveth, and today I'm going to demonstrate the incidence of cerebrovascular accident and its risk factor among hypertensive patients in a community hospital. In Thailand, stroke has become a high and rising major health burden over the past decade. It's a significant cause of death and long-term disability. An emerging view supported by recent trends is that the growing burden of stroke is driven by a neglect in control of vascular risk factor, particularly hypertension at population level, which is also a public health challenge worldwide. There is, however, in Thai rural areas, a lack of information on the incidence of strokes and their risk factor associated with hypertension. There's also a pervasive lack of health personnel and weak health infrastructure to support stroke survivors in these regions. To be able to create a heart-healthy and stroke-free community, there is a dire need to identify the key risk factor for stroke occurrence to support intervention aimed at stroke prevention. And that is our objective. Our study design is a retrospective cohort study from 2011 to 2022. We recruited 2,578 hypertensive patients in Thailand Hospital locally. It's an F2 level 30-bed secondary care hospital for IPD patients. By including diagnosed hypertensive patients with greater than or equal to 18 years of age and exclude those who have previous history of CVA before diagnosed hypertension. We conducted characteristic description of gender, age, occupation, and health insurance in percent mean and standard deviation. Incident rate were calculated. For analytical analysis, we use time to event analysis of survival analysis of CVA in hypertensive patient, and then we use proportional hazard regression to indicate risk factor as shown. The result is groundbreaking. In the demographic area of hypertensive patient, the mean age of first diagnosed hypertension is 60. Most of them are female, has universal coverage, and work as employees. Mean body mass index in Taiwan community is unfortunately in the pre-obese classification. Systolic and diastolic blood pressure is 140/80 approximately, respectively. But fortunately, most of them are non-smoker and non-drinker. For this population, dyslipidemia was a majority, and myocardial infarction was a minority. Yearly incidence of stroke in this study was peaked in 2016. This is due to Taiwan Hospital created intermediate care ward in post-stroke that improves stroke care enhancement. Other data are unremarkable, which this number are shown in detail in the table. Okay, and then we plot the Kaplan-Meier graph. For 10-year survival of CVA, there was 93% of survival rate in the overall cohort approximately. If we look further at the age group, in the group of more than 80 years of age, survival rate significantly dropped from the other group. In this hospital-based retrospective cohort study, an incident calculated was 8.05 per 1,000 person years. Regarding incident in age group, in an age group which is less than 80 years, incidence of males more than female, they become almost equal and were at the highest peak when the age of the patient is more than 80. Univariate and multivariate were calculated before computing the proportional rule, and the result are this and this. Okay. For coming to the highlight of today's study, with Cox proportional with adjusted hazard ratio, we are able to identify the 3 significant factors and 1 protective factor. The age above 80 after first diagnosed hypertension and male are the significant risk factor, and government enterprise officer is the protective factor, and current smoker is the most significant modifiable risk factors. So then what we get from all of this? This is the first evidence to identify incident rate and predictive factor of CVA among hypertensive patients in Thailand. From this report, the incident rate of CVA was 8.05, which was higher than the incident in England and Japan in general population, but lower than in China in hypertensive patients. There was an upward trend of prevalence of aging and CVA. Since hypertension is a progressive illness, it increasingly develops a severity with a rising age. And regarding smoking, it's also a considerable modifiable risk factor contributing to the atherosclerosis, which is the main etiology of CVA. Due to more procedure and medication accessibility of state enterprise officer is a protective factor. And relating to gender, being male was a statistically significant factor due to hormonal difference in each gender, especially estradiol. So we found that incidence rate of this study is 8.05, 10 years of age was 93.97%, and age above 80 was the lowest trend. Modifiable risk factors current smoking, non-modifiable risk factors being male, age at first diagnosed hypertension above 80 years old, government or state enterprise officer was a protective factor. So there's some limitation in this study that is the lack of confirmation of stroke with neuroimaging, which is considered the gold standard. And the short period of the study lacks the ability to demonstrate clear manifestation of the overall trends. In lifestyle modification part, this study could potentiate and emphasize the pre-existing smoking cessation program, and this could be a pilot data for the national healthcare system development in NCD clinic. But further investigation in other areas are required. Ethical approval was obtained from the Institutional Review Board, Royal Thai Army Medical Department. Thank you.
So, thank you so much for the fascinating presentation. Is there any question from the judges?
I could talk more about further suggestion of study, but if that's the...
Okay, hello. I think the ministry should see your paper, try to publish it. Okay. Good finding and really interesting. I'm not sure, can you retrieve the data about the type of CVA between a hemorrhagic and ischemic stroke from the IVD?
Okay. This study is a retrospective cohort study. It's secondary data. So the further study would be to subgroup analysis type of CVA. This study is not yet subgroup analysis. There are so many benefits, as I think you all have already known this, but it's able to distinguish ischemia from hemorrhage, exclude those stroke mimics. So it will be in the further studies. That's my answer.
Okay. Not a comment, but just a suggest, because I think if you can divide by the nature of the stroke type, I think you will see the effect of uncontrolled hypertension more maybe in the hemorrhagic type, for example.
Yeah. Oh, thank you very much for your suggestion.
In additional points, I think the age, because the age group you to mention about the age group more than the 80 years old, but the hypertension is have the hypertension in the young and hypertension in the older age. The benefit for this point is if you to analyze the subgroup, because the cause is different. Hypertension in the young is less than of the 45 years old. It's maybe for AVM. But it's more than the 45-year-old is from the vascular disease atherosclerosis. If you have the subgroup, it may have the interesting result.
Thank you so much for your further suggestion. This will definitely in my further study. Thank you so much. Are there any questions or comments?
We still have a minute left. Can we have a question, please?
Okay, there is no more question. We're, of course, taking some time for judges to put down some score.